We're also working with the liver to make everything flow smoothly. So a lot of these comorbidities I'm going to treat through a TCM, traditional Chinese medicine approach. And one of the things that's really beautiful in my mind about acupuncture is we can work on on the mind a lot without, having to do as much of the, with just needles and herbs. That's something that.
No, it's good.
Yeah, that's something I've forgotten to mention so far, which my teachers saw me up here, they'd scream at me for not mentioning herbs before now. We use herbs a lot, Chinese formulas, complex, 5 to 30, or, well, probably not 30, but 5 to 20 herbs in a formula to treat both the pain and the comorbidities that go along with it. Another common comorbidity, if I could indulge you all a little bit longer. Another common comorbidity, particularly for musculoskeletal pain, is going to be obesity. And a lot of times, if I work on somebody's low back pain and their hip pain, and I get them somewhat better, it's going to get worse and just come back. So you got to work with them on that aspect. Another comorbidity that is common that I would say is, and I suppose probably most Americans wouldn't really think of this as being a comorbidity, but it's overwork. In traditional Chinese medicine, a common etiology or source for a disease is overwork, overdoing things. And this goes back to the limited activities. You got to teach them to do their activities in new ways that they aren't going to be overdoing it on a constant basis, stressing out their body, causing the inflammation. You got to get them to work in new ways. And then the final thing that kind of ties into a lot of this is one of the things another modality that we use a lot is energetic. Originally, when the Westerners first came to China, they called them calisthenics, but it's things like Tai Chi, Qigong, and that's going to work on getting their energy to flow well, work on their mind, teach them how to do things in new ways so that they don't overstress themselves.
And it's also exposure for fear of movement. So I think that from a psych perspective, we talk about fear of movement being a big thing that drives pain chronicity over time, and gentle, gradual movement helps with that. Mindful movement.
I used to have a doctor who worked for me, and she was like a yogi, and that was her spiritual background. And so I would have these patients who would be in a cane or a walker, and she was like, well, I'm going to do yoga with them. And I was like, how in the world are we going to do that? And it was all on teaching them how to breathe. And and it's little movements, and it was really, it's amazing. You can do a lot. You can do a lot. And getting people moving, I think, is super important.
I had a patient once who taught elderly yoga, and
Yeah.
a lot of them, they stayed seated, but they still did, upper body and stuff. So,
Yeah.
anyways, I'm done.
I'm sorry. Thank you.
No, that was awesome. Thank you.
That's good. Well, you guys just go. Just do your thing. Dr. Newman.
Here's what happened the first month of practice. You never heard about this, you never read about this, you saw this. Patient says, Doc, am I not sleeping right? You go, what do you mean you're not sleeping right? You never learned how to sleep? Well, I wake up in the middle of the night with my back is killing me. Or I wake up in the morning with this crippling headache. I said, really? Every single morning? Yeah, every single morning. I said, geez. Well, you can talk about the bed, you can talk about the pillow, you can talk about all these things. Or you can say, well, what's happening here? Now, anybody have kids here? Anybody have children? All right. Did they all sleep through the night? Yes or no? Okay. So first, when someone has a child, first thing I ask is the kid sleeping through the night? And like half the time they're not, right? So let me tell you, sleep disorders is massive. And someone's going to figure this out someday, but the fact of the matter is, a high percentage of the population has sleep disorder. It can be not just not being able to go to sleep, or not staying asleep, but sleep apnea, snoring, or anything worse. Anything gets worse at night, is a sign of a sleep disorder. So we have a specific definition of that, which has to do with a way of evaluating the sleep mechanism. So it's a very concrete syndrome, you might say, and it's correctable once you analyze it. But it's part of the same formula. Make the specific functional diagnosis, get it analyzed properly, and make the correction. But the key about sleep disorders is that you can't heal. If your body is going out of balance when you're sleeping, that's when your body's supposed to regenerate, heal, rest, and if you're not sleeping, your body is literally out of balance when you have a sleep disorder. So in a certain way, you can't sidestep it. At least I found that. So you have to, and when you do correct it, if you can, which is a very high percentage of the time, then it's wonderful. Then that gets normalized, and then usually their symptoms are allowed to proceed into resolution. So keep it in mind. It's a very, very big issue, and I think medicine is actually just catching on to the significance of sleep disorder. You see more and more. It's like more cancer association. So it's a really big system. It has to do with the fundamental mechanism in the central nervous system. So keep that on on your tabs there.
Yeah, go ahead.
If I could just riff on that, a lot of times I tell my patients even, I figure if half my battle is if I can get them to sleep better, that's going to make everything better. So I do a lot of times talk to them about sleep, and like getting them to sleep better is a major part of it. And it goes back to that whole idea of the shed.
Yeah, I would just say that sleep, insufficient sleep is incredibly prevalent in adolescents in particular. The American Academy of Pediatrics has caught on to this and now recommends late school start times for high school students, which has not happened in Portland yet, but it happened in Seattle. So eventually we'll catch the wave. But I think that it's very intertwined with our cultural ideas about how much people should be working and how much you should be doing in your day. And teenagers, I think, more than any other age group, show that pressure just in terms of being incredibly overscheduled and then getting insufficient sleep. And as it turns out, you only have to deprive someone of sleep just a little bit for a couple days and they all get headaches and other pain problems. So there's lots of great experiments.
I'll just kind of piggyback on the sleep because I think it's important. So I think if there's anything that you take from this panel, you'll see some consistencies. And I think you'll see that, we all maybe do things a little bit differently, but it all works. But like, sleep is huge. If you guys have somebody coming with pain, if you truly want to go down this train, which is like a complex thing, you have to be able to take the journey with the patient. You're going to be able to have to organize a system that you can actually really help these people. And I think making sure that they sleep is important, their anxiety, their depression, the mental emotional aspect, as well as like dealing with the inflammation aspect. However you deal with that is extremely important. And you just got to get good at a few of those so you figure out how to assess it and do it well. One of the things I've seen consistently with different pain groups I'm a part of, and this is like national groups, is I've heard sleep doctors who are NP trained say, do not give your patients sleep medications. It messes up their normal circadian rhythm and really can have an impact on really them having restorative sleep. So that's something that I've heard repeatedly enough to where I would say, like, you just want to be careful. People are taking things to sleep. You need to make sure that you're doing adequate things to give them proper sleep hygiene, which is a whole different lecture. I'll just be really quick, one of the most common comorbidity kind of issues I deal with chronic pain is diabetes. So what I have noticed, and this is pretty consistent, and there's literature out there, is most of my patients, and I don't know if it's the same with all of you, but I mean, maybe not the pediatric patient population, but most of my patients are 70-80% women. So they pay attention as a gender to your body, and they come in and there's complaints, and men don't come in unless something's broken or fallen off. But what I've noticed is that with chronic pain and like shoulder pain specifically, like diabetes has a direct correlation with that. So if somebody is like not regulating their blood sugar well, or they're diabetic and their levels are off and it's consistently off, you will see common rotator cuff issues and inflammatory processes, and I see that commonly with women who are probably 40 to 50 and have their blood sugar off, they will definitely have like rotator cuff syndrome, and that's something that I've correlated. So you get that under control, you can actually get their pain under control.
Thank you. So we've got just a few minutes left. Does anyone in the audience have any burning questions that they don't feel like we've addressed already? I'll let you guys think for a minute while I remind you that in just 5 minutes, there'll be some snacks set up in the back. You can help yourself. And then out in the lobby area, we're doing a raffle. So you can buy their $1 ticket, or you get 6 for $5, and you can put specifically into what pot or which prize that you would like, and then we'll be doing that drawing during the social later tonight. So does anyone have any questions? Yeah, Jen? Just holler.
Hello.
Hi.
I was just wondering how each of you in your different fields handle patients with a history of substance abuse and with pain that is actually legitimate pain instead of pain they're trying to say they have to get more medication.
Did you guys all get that? Okay.
So it's probably less of a problem in pediatrics, but there are certainly kids who we do see where substance abuse is a big issue. There's very few situations where our pain team is really wanting to put kids on opioids. We see kids who are already on them and we get them off of them. So